And now it is time for the first of our organs of the GI tract, the esophagus. Sorry, I get kind of excited. The esophagus goes from the oropharynx down through past the laryngopharynx, all the way down through the diaphragm to the stomach. It connects to at the pharynx with a superior esophageal sphincter right here that opens whenever you swallow, and it's closed during inhalation. And then at the bottom there is an esophageal hiatus through, that's the hole in the diaphragm, and then just below that there is the inferior esophageal sphincter, which remains closed except when a bolus is moving through it, and that helps to prevent acid and food in the stomach from going back up through the esophagus. If you've ever vomited, you know how unpleasant it is when that stomach acid goes up your esophagus. Acid reflux is what happens when this acid from the stomach washes back up or refluxes from the stomach into the esophagus. So this here is showing the lower esophageal sphincter closed, as it should be. Here it's not closed properly. Acid from the stomach can wash back up and actually damage the tissues in the esophagus. The pain from this is called reflux esophagitis. Itis, of course, refers to an infection. So the pain of that causes an immune response, which causes, gets an infection. Reflux is more common in smokers. It's more common in people who are overweight, especially in people who overeat. And part of that is just that the stomach can only stretch so far, and filling excessively with food actually does push on that sphincter and sort of force it open. So here is the esophagus looking pretty pained, and the stomach saying, brain help, the acid reflux is getting bad. The brain says, let's try cutting back on our trigger foods. And stomach says, thanks. And then tongue, who doesn't pay attention to anybody, is eating a chili pepper. And esophagus says, tongue, didn't you hear brain? Why are you doing this? Tongue says, I like the taste. Which, I don't know, if you're like me, I can't stay away from my favorite foods. Oh well. All right, so if you have chronic acid reflux, then you have gastroesophageal reflux disease, or GERD, and that actually causes scarring and erosion in the esophagus, like this. Barrett esophagus is an advanced form of this where we get really serious scarring throughout the esophagus. A healthy esophagus should look like this: nice, smooth, even tissues, nice, even layer of mucus all over the place. Barrett esophagus shows this severe scarring, can lead to esophageal cancer. So heartburn, which is what acid reflux is a very serious issue, and it does need to be treated because it can lead to scarring and eventually, if untreated, esophageal cancer. Now, the esophagus only does propulsion. Its job is to move food from the pharynx to the stomach. That's all. There's no absorption that happens. There's no mechanical digestion. It just moves the bolus down to the stomach. Because it's moving food that's been chewed, but not necessarily broken down very far, it has a very thick mucosa with a really thick stratified squamous epithelium. And you can see here how thick this is. It almost looks like thick skin. It actually does have little indentations, just like the skin. It has a pretty thick lamina propria between the epithelium and the muscularis mucosa. Remember, this is the layer that separates the mucosa from the submucosa. So this whole mucosal layer is really, really thick. When we look at it on a microscope slide, we're looking at all of this as the mucosal layer. And that's all just to protect the deeper cells from getting damaged when you, for example, chew or swallow a tortilla chip that you haven't chewed enough and it scrapes down your throat. What you're feeling is that tortilla chip scraping down this stratified squamous epithelium. The submucosa has a lot of elastic fibers. That's this layer in here, so that the esophagus can stretch while we're swallowing and then return to its original shape. It also has lots of mucus glands because we do need that thick mucus layer to provide lubrication for the whole esophagus. And also, since this is a stratified squamous epithelium, this is not producing any mucus on its own. It has to get all of its mucus from the submucosa. That's also different from some of the other layers that we'll see. The muscularis is 2 layers, just like everywhere else, one circumferential, one longitudinal. It is made up of skeletal and smooth muscles. The skeletal muscle contracts and returns to shape faster. That's what you feel in your throat when you're swallowing. The rest of it is smooth muscle to continue that contraction down toward the stomach. This is a zoomed in higher magnification of the esophagus. So you can see this nice thick epithelium, the lamina propria with the mostly areolar connective tissue. This part right here is the Muscularis mucosa. You can see it kind of looks like this Muscularis externa out here. They're both smooth muscle primarily. This Muscularis mucosa is only smooth muscle. The submucosa is here, and you can see that as the mucosa indents, the submucosa also indents with it. Notice that the Muscularis externa does not indent along with it. And we're going to see that throughout the GI tract. And then you can't really see the adventitia around the outside, but there is a very thin connective tissue layer around the outside. And that is our esophagus.